everybody, Dr. Daniel, and today I'm talking about tension-type headache tips and treatment. Tension-type headache is the most common type of headache, present in about 70% of individuals, while migraine is present in 30%. 99% of all headaches are either tension-type headache or migraine, with 1 to 2% being something else. The cause of tension-type headache is poorly understood, and the pathophysiology is said to be neurobiological. Tension-type headache pain is mild to moderate and described as tight, tense, or pressure. It has none of the features of migraine, such as severity, throbbing, nausea or vomiting, or sensitivity to light or sound. It does not put a person down, limiting activity as migraine does. The pain of tension-type headache is commonly located in the neck, jaw, or temple area and should have pericranial tenderness or pain on muscle palpation noted on examination. Associated findings. This is complicated, but I'm going to give you the International Classification for Headache Disorders, version 3, how they classify tension-type headache. And this is mainly for research purposes, but they have what's listed as infrequent episodic tension-type headache with or without pericranial tenderness, frequent episodic tension-type headache with or without pericranial tenderness, chronic tension-type headache with or without pericranial tenderness, and probable frequent, infrequent, or chronic tension-type headache with or without pericranial tenderness. Okay, well, let's get into some stuff that you and I would talk about or know. What are the previous used terms for tension-type headache? It has been called in the past tension headache, muscle contraction headache, psychomyogenic headache, stress headache, ordinary headache, essential headache, idiopathic headache, psychogenic headache. A tension-type headache is common with a lifetime prevalence in the general population, ranging in different studies between 30% and 78%, and it has a high socio-economic impact. While it was previously considered to be primarily psychogenic, studies since International Classification Disorder 1 strongly suggest a neurobiological basis to tension-type headache, especially for the more severe subtypes. What does tension-type headache feel like? Descriptive terms would be tight, tense, pressure, squeezing, band-like, clamp-like. A lot of the ads in the past for neurologists in neurology journals have shown a patient squinting down with a band on their head. Is tension-type headache confused with other headache types? Yes. Confusion between tension-type headache and migraine is very common, and many persons have both tension-type headache and migraine. Also, it is difficult to differentiate between tension-type headache and medication overuse headache, so that for the doctor, both the diagnosis of migraine and medication overuse headache should be added to tension-type headache diagnoses when appropriate. How is pericranial sensitivity perceived? How do you check for that? What does that mean? Well, the examining physician palpates with his fingers over areas of pain indicated by the patient using 2 fingers to check for perceived patient tenderness at that spot. You ask the patient, does this hurt? And you move your fingers back and forth, and they'll say yes or no. What type of tension-type headache is the worst? Chronic tension-type headache is the worst types of tension-type headache and is a significant medical problem which causes decreased quality of life and disability, requiring headache specialist consultation and prescribed medication. What is the treatment for tension-type headache? Aerobic physical exercise should be performed by everybody. I'm going to work out at the YMCA this afternoon, but it's especially recommended as treatment for tension-type headache, aerobic exercise. Also, massage, rubbing the affected area, and heat from a pad or a shower are helpful. Patients with tension-type headache often do not sleep well, and drugs in the class of tricyclic antidepressants such as amitriptyline, nortriptyline, or doxepin may be used for sleep and pain relief. Okay, that's all I've got to say today about tension-type headache, a really common headache problem. God bless all you folks who have that, and I'll see you again on the next podcast. Please click subscribe and like down there. Bye-bye.